And thank you for being on my channel. One race, human race, all are human. Everyone has a right to life, liberty, pursuit of happiness. Look, this coronavirus, what needs to happen, right? What should have happened back in January 2020? There should have been a mask mandate. It would have saved hundreds of thousands of lives with a mask mandate. But instead, you had people saying, oh no, it's not going to be that bad, blah, 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 blah. It's serious. It's real. And right now we need to have a mask mandate. Right now we should really shut down the entire country, for at least 2 months and then reopen, all right? And be stronger for it.
Daily cases in Tennessee. Let's show you that graph because that's a really stark visual there. From early November to the current day, we're seeing that skyrocketing graph. And then the hospitalization, same thing, a very steady increase in a scary way. The governor here, Bill Lee, says that, people's Thanksgiving choices are catching up to them. He says the vaccine is a good thing that it's rolling out, but it will take time for that to have impact. And he says the vaccine will not solve people's selfishness or foolishness. He's asking people to please wear a mask, not to gather for the holidays, but we should point out that there is still no statewide mask mandate. According to the Tennessee Health Department, they put out on Twitter yesterday that the positivity rate for their tests is more than 21% right now, and that of the IC.
Remember that President Trump knew about this virus back in January 2020, and don't forget his interview with Bob Woodward, reporter, on February 7, 2020, not making a big deal out of it, right? Knowing how serious it was, okay? And the Democrats have to remind the American public of that because Democrats, President Biden will be blamed for whatever problems he's inherited. And he has to remind them that it all got started, by fumbling of the ball from the Trump administration. Okay, that's fact. Go back and look at all the things that President Trump said about the virus and it not being that bad and it'll go away, all that kind of stuff, right? Okay, just go back and look at that. Right now, it's important. Why? Because people have to understand the cause and effect. Well, you didn't do anything to protect the American public. So naturally, people are going to pass away from this virus, right? They made it out like it was a hoax. It's not a hoax, okay? It's real. And people have passed away who should not have passed away. Do not blame Jesus. Do not blame God. Do not blame Yahweh. Do not blame Jehovah. Do not blame Allah. Do not blame the supreme intelligence, or whatever you call, God. This is man who did this, okay? And it didn't have to happen. And people should not be dying right now. This is horrible. Everyone in America and the world has a right to life, liberty, and pursuit of happiness. Wear the mask. Stay home. And let's make sure everybody has survival checks.
Beds across the state, only 8% of them are available, Kate.
So Dan, let's bring you in on this as well. By comparison, what's going on in California?
Well, Kate, the state is in the midst of really this unprecedented surge. Yesterday, you had 52,000 cases. In the last 48 hours, you had more than 100,000 cases, and that is putting a severe strain on the healthcare system. As you alluded to, ICU beds really getting low. Statewide, it is at 3% in Southern California. It is at 0%. Now, the state has set up these alternative care sites. There are 11 of them. 5 of them have been activated right now, and they do have patients. And here in San Francisco, the city has taken more aggressive action. The city is saying that if you are coming into San Francisco from outside of the Bay Area, that you need to quarantine for 10 days. That includes people who are traveling, people who are moving, and people who live here. It's just another example, another sobering example that the pandemic is not slowing down. Kate?
Not even close. Dan, thank you very much. Natasha Chen, thank you. Joining me right now is CNN medical analyst Dr. Megan Rainey. Rani, she's an emergency room physician at Rhode Island Hospital. It's good to have you back on, doctor. Thank you. Rhode Island is also, I guess there's no state that's doing great right now. We can say that. But Rhode Island is also a state with one of the highest rates of new cases per capita in the country. What are you seeing right now in your hospital?
Our hospital has been under surge for quite a while now. We opened up our field hospitals, our alternative care sites, on the 1st of December. The hospitals continue to be tremendously full. Our intensive care unit capacity continues to be low, and we continue to see more patients come through the door, both who are sick from COVID-19 and who are suffering from its after effects. So at this point, the surge has been going on for long enough in Rhode Island that we're seeing folks who are coming in with those symptoms of long COVID who are just not getting better or who are having new complications as a result. So we're also seeing increasing numbers of healthcare providers out sick. We have holes in our schedule where we're calling in backup docs pretty much every day between now and the new year because so many of us have had to quarantine or have gotten sick ourselves.
I also read, just to add to that, doctor, that you're now seeing entire families coming to the ER at the same time. How do you handle that?
The first thing is how sad it is. It is really difficult, we know, to separate from your family members when you're sick. And that's why we see such spread within families. We have a lot of multi-generational households here in Rhode Island where kids live with their grandparents, with aunts and uncles. And when a lot of people come in with the same last name, one of the things as a healthcare provider is that makes me nervous about mixing up medications or writing the wrong thing in the wrong chart. So we actually have protocols to separate folks into different parts of the emergency department so that we don't make unintentional mistakes in taking care of them.
Gosh, I never even thought about that aspect of it. You're absolutely right. So you now have this startling new data point. You have 1 in about 200. Every 200 Americans is now infected in just the past 7 days. What should that rate of infection mean to people everywhere?
What that rate of infection means is, my goodness, if you have been lucky enough to escape this virus so far, now is the time to double down on all of those measures to protect yourself and your family. It is everywhere. Anything that you do, you are putting yourself at risk of exposure to COVID. This is the time to stay home, to avoid indoor restaurants, to avoid indoor gatherings, to not see people who you don't live with without a mask. And if there's any way to not go physically to work right now, now is the time to do that. We need to make it through this next month so that the vaccine can start getting distributed. Now is the time to double down to protect yourself.
You just received your Pfizer vaccine this morning, I understand it. You've gotten many shots in your life, of course. There's a picture of it happening. What was that moment like for you?
I got a little teary as I got into the room. This is the light at the end of the tunnel for me and for so many healthcare workers, and honestly for our entire nation. Receiving the vaccine itself was nothing. It hurt less than a flu vaccine. I expected it to be this big momentous deal, and it was just done. It's been a couple of hours now, and I still feel completely fine. I, like everyone else who gets the vaccine right now, got monitored for around 20 minutes afterwards. None of us had any adverse effects and got to go home just fine. But I'll say the thing that is most